I think I'm too tall for this. Maybe I'll try this. This is very hard for me. This is sort of winning a Nobel Prize or even an Oscar or something. So please bear with me. We will do a clinical program, or yes, we will do definitely a clinical program. And you will see that my slides are also extremely clinical. So thank you very much, ladies and gentlemen, for the opportunity to present our project. The grant would allow us to start a community of practice, and we would use the community of practice education model. If you don't know what a community of practice is, like when we presented our dream, we didn't have words for what we would like to do. We see that a community of practice can be described as a model of situational learning that is based on collaboration amongst peers, where individuals come together and work to obtain a common purpose that is defined by knowledge rather than task. Communities of practice are tools for collaborative working and shared learning in settings outside of hospitals, as we all know that more patient care takes place in the community than in hospitals. Now, our community of practice will be situated in Soshanguve Extension 12 and 13, and it will allow us to develop our current mobile health clinic service. And there you see is an example of our current clinic, rendering primary health care to the community. When we started with this project about 3 years ago, we started with 2 or 3 women coming, and the last report that I got is that the lecturer and the 4 students saw 91 women presented themselves. Now that is also not an ideal situation, so this really needs to be addressed. Okay, and then all our teaching and learning and research will focus on this hub or this community of practice. We started other pilot projects. There you can see on my left-hand side, I suppose yours as well, is that Amazinko, the corrugated iron structure, where we did a cardiovascular screening project. And then next to it, that Amaplanki was the cancer screening clinic. And I hope you see the breast on the door. And what amazes me is what that man was actually doing there. But at the bottom, you will see that is what it looked inside that Amaplanki. Gynecological bed and a small little chair, and then enough space for a trolley, and then the floor was just swept with a piece of plastic, covered with a piece of plastic. Also no window, also a piece of plastic. We covered the window, and the students screened 300 women in that facility. Okay, now our community of practice will consist of 5 legs. A primary health clinic, the current clinic, that is a mobile clinic, and we would also add a mobile cancer clinic. Also a mobile palliative care clinic, and also mobile, a diseases of lifestyle clinic. And as we have the mothers and fathers coming to the clinics, we thought that we would start an early childhood development project as well. If we look then at the organizational chart for 2009 until 2012 for the grant, you will see that all the staff except the HOD, that is I, will be added by the project. I didn't calculate because I don't think I can calculate these huge numbers. But for me, it is really, really overwhelming. If we look at the services that we would render and the learning opportunities, we see that our primary health clinic will award us 4 learning opportunities. Now, don't think it's for a year. It's for every time the clinic goes out. So, and we're already doing a healthy baby clinic, but we will add a sick baby clinic and also immunization and family planning we are currently rendering. Now, the cancer clinic, I'm an oncology nurse, so we will definitely do cervical screening with a visual inspection with acetic acid and also pap smear. Also punch biopsies, that is actually a new procedure that nurses will be taught by a nurse coming from Tanzania. Treatment of the cervix precancerous lesions with cryotherapy and also colposcopy, that would be a first for nurses in South Africa. With the breast, we will do fine needle aspirations and clinical breast examinations, and then physical examination for cancer like carposisarcoma. Now, interesting is that carposisarcoma is actually the cancer that kills most men in sub-Saharan Africa, and also the third most common cancer amongst females in South Africa. Yet, carposisarcoma does not appear on the list of the 10 most common cancers in South Africa. This means that we have so many people in the community that are never diagnosed. We all know that carposis cannot be cured. Sometimes it cannot even be treated, but carposis is the results in a lot of pain that is then never managed. Then also referral and the treatment of lymphedema. And this would also award us 4 learning opportunities, either for oncology nurses or for first-degree students. Okay, then the palliative clinic. We will do some pain management according to the World Health Organization step ladder, management of other symptoms. Very important is spiritual care and psychosocial care, hope nurturing interventions. That's my passion. I always ask the students something if I have 4 or 5 marks left. Wound care, and I wrote the wound cancer, my goodness. And then also the care of the family. We would also have a lifestyle diseases clinic where we would do HIV/AIDS testing and counseling, prevention of this very common disease, and the prevention and management of hypertension, obesity, and also do some weight reduction strategies. And then the smoking prevention, of course, and exercise as part of a healthy lifestyle. That would award us another 4 plus another 4 learning opportunities. Our early childhood development project, we will do some growth and development monitoring, screening for impairment, and then activities to stimulate psychomotor development, and also nutritional support to prevent stunting. And this would add 16 learning opportunities for us. And all these different clinics will then also award us so many more research opportunities, because everything that we will do will end as a research project. Okay, then we could also, in our proposal, include scholarships for 5 full-time postgraduate students per year. We found at our school that if you do not substitute the salary of the nurse, she cannot study full-time. It is just impossible. And due to the shortage in the clinical areas, nurses are really, they work so hard that it's not always possible for them to complete their studies. And then, lastly, I want to ask you and invite you to benefit from this project, because we will also struggle and suffer, I'm sure, but we will share that by means of a website that would be created in the first 3 months of next year. So please make sure that you walk the road with us and check our website. Then I would just want to say thank you. Thank you to everybody. This for me was I'm middle-aged, so I am allowed to cry. Was an incredible learning opportunity, and I think I also grew, also I think in the body a little. And I really want to say thank you to Dani Ferns that sits there in table 5. He was really my support. He supported me in a very alternative way, and I can never tell you how he did that, but he made me laugh so much that after I've laughed for half an hour, I just had the energy to continue. And thank you very much for listening to me, and thank you for all the congratulations. This is really, really a dream come true.